The Drug Abuse in Nigeria Survey 2018 reveals that 14.3 million persons between the ages of 15 and 64 are involved in drug abuse. This figure is put at 14.4% of the population, a figure far higher than the global prevalence average rate of 5.6% indicated in the World Drug Report 2019. Mr. Mumini Raji is Commander National Drug Law Enforcement Agency (NDLEA) in Ondo State.
Our youths are unfortunately deeply enmeshed in this menace called drug abuse. It has become like a trend, like a fashionable thing among them. And that situation ought to actually be the population, the working population, the most resourced population. Unfortunately, that is where we find ourselves. And of course, you find them in schools, secondary schools, you find them in tertiary institutions. Incidentally, in Ondo State, the trend remains the same. That is the population that the menace of drug is fastly eating into. And the earlier we address the situation, the better for us, so that we can have a secure tomorrow.
With Nigeria boasting a very youthful population, having around 70% of its estimated 200 million plus population under 30 and 42% under the age of 15, the preponderance of drug abuse and its spiraling effect remains a concern for some citizens.
It's scary. What we thought was just limited to taking of Indian hemp has gone beyond that, and that even teenagers are now exposed to taking hard drugs. Many of them that are now working cops, many youths now are dead men or women working. Look at the number of accidents that happen. Look at the number of violent crimes that happen. It's as a result of drug abuse. It's, sincerely speaking, it's scary. In my streets, there was this guy, he has been taken away now because he ran mad over the abuse of drug.
A consultant neuropsychiatrist, Dr. Akinwumi Akinwoye, says drug abuse comes with attendant short-term and long-term effects on health and public safety.
What we observe presently is that up to 80% of the patients we see, especially among the males, we have increasing number of females to using drugs now, quite very high. But especially among these, up to 80% of them who we admit as a result of drug. All these drugs, cannabis, cocaine, various stimulants and all these drugs that cause the mental health issue for them. And when we look at mental health, when we say mental health or mental illness, it has to do with functioning and productivity. Meaning that many of them, when they come down with these mental health complications of the use of this drug, then they become non-productive. They become more or less useless. Their functioning decline gradually over time, and they just become useless and become burden to the society.
Temitope, not his real name, is a young Nigerian on the road to full recovery from drug abuse after 10 years. Peer pressure was his undoing when he entered higher institution.
The journey has been a very big battle for me, actually. I actually started doing drugs around when I got into university. Yes, that was my 100 level days. I had some friends because we were staying in the school still. So I had friends over, we do talk, we gist and all. Then, just from peer pressure probably. And actually I was in this stage whereby I wanted to explore. So I was ready to try anything. I was just trying to get into the whole thing, like how to actually behave in school or something like that. Then I took the wrong turn. I took a very bad detour in my life, and it actually affected me.
He enjoins other youths to stay clear of drugs.
You have to be strong. You have to be strong-willed. You have to make that decision today that I'm done and I'm done. Because there is something we call relapse. You can always relapse. But my brother and my sister, if you can actually say it, do it, put it into actions, and by God willing, you will win.
Combating this menace, some stakeholders believe, must include sensitizing youths on drugs and their harmful effects.
Gone beyond the time that we say don't or no alone. Now we talk about no, the other no, which is KNOW, like increasing our sensitization. Now when you look at the street, you see a lot of young people just walking around, and you will know that this person is mentally deranged. When you leave them on the street, the more the pattern continues. The more you leave people that are down with, that are under the influence of drug or substance abuse and they have lost their senses, if you don't rehabilitate them, it will also influence others as well.
In our client, we value respect. When they take these things, they don't know anybody again. And that respect that we value, wherever they come across with, the moment they are into that drug, they can do what's unthinkable things that will bring even the names of their family into disrepute.
The message from these stakeholders is for parents, government, and other relevant social structure must pay close attention to the upbringing of young ones in society. Zaheed Aribisala, OSRC News.